possible marked like this. And
Transverse and oblique arytenoid.
yes, the muscles. So the muscles, the transverse and the oblique muscles, arytenoid muscle, is a position where we have the, look, this is the posterior cricoid cartilage, posterior aspect, and the superior aspect of this cartilage here, joined from the ligament, the cricoarytenoid ligament. So this one is a position of the arytenoid cartilage here. So this, you have the space where we have the muscle, like the oblique and the transverse. So where we marked here, you have the choice. This is your choice. You choose the muscle, which muscle we mark, because here pass together, but you must know always the superior aspect of the structure here, so where we marked, is a oblique, because the transverse pass like my finger, and the oblique goes from the superior to inferior, from the lateral to medial aspect. This is the direction of the fibrous muscle, yeah? So this is the oblique, this is the transverse, but here you do not recognize the difference between the muscles, so it's possible marked this space like the oblique or transverse arytenoid muscle. And
then the arytenoid cartilage there.
but I add you from the list, maybe you have the muscle, the cricoarytenoid posterior muscle. Yes. So the cricoarytenoid muscle is here. This one. You see this? It's a muscle. Here you have the muscle fibers. So where I pierce it like this, the cricoarytenoid posterior muscle. And I think I asked about this muscle during the written test. Yes, because this is only one muscle. How work from the vocal folds? You remember? Like the abduct or adducts in the vocal folds, and the rest muscle. So adduct or abduct?
Abduct.
Abba.
Abduct.
Yes, and the rest is the adducts. Yes, so this is the adduct muscle. This one is the adduct muscle. So here is which muscle? This is the vocal muscle. Yes, this one is the vocal fold, and the vocal fold is forms from the vocal muscle. So this one is the muscle. Or this muscle is called like the thyroarytenoid muscle. Sometimes from different book is the same muscle. Yeah, and the next one?
Cricothyroid ligament.
Cricothyroid, yes, of course, the cricothyroid ligament. Here you see, and this is the inferior border of the thyroid cartilage. Here you have the superior border of the cricoid cartilage. So this one now is a membrane of the ligament, the cricothyroid membrane ligament. This is the same, of course, yes. And here is not visible. So this specimen, or maybe from this specimen, I show you, because when I look from this specimen, yes, this one is maybe the better. So this one, you see, here you have the thyroid cartilage. Yes, this is the superior, this is the inferior. So this one, where I mark like this, the cricothyroid ligament of the membrane. This two is a correct answer.
And the thyroid.
Thyrohyoid, with the thyrohyoid, but you do not have from your list. But
Yeah, I'm
of
just
course,
asking you.
yes, of course, the thyrohyoid is here
Okay.
or here, yes, because this is the anterior and goes from the lateral. So thyrohyoid is here, and this one, cricothyroid, yes. Okay.
Piriform recess.
So from this specimen, the piriform recess is here. Yes, this one. Piriform recess, like this. And
Areoepiglottic fold.
yes, so the areoepiglottic, this one, you see? Now it's visible. So maybe I marked you. I show you like this. Areoepiglottic fold. So this one is a which fold here? You remember? This one is the glossoepiglottic, medial, lateral fold. Areoepiglottic is here, and here we have one extra ligament. You see, or fold, the the pharyngeoepiglottis fold here, but you do not have from your list. But you must remember during the written test, here you have the fibers of the muscle. Which muscle? Who remember? Which muscle goes here? From the hyoid bone you have here. So this is the stylohyoid muscle and the stylopharyngeal fibers. Here forms this ligament. But this is the part of the written test, of course, the question. And the next?
So the suprahyoid muscle is the mylohyoid.
Mylohyoid. Okay, so mylohyoid is possible marked here. The suprahyoid muscle. Mylohyoid. Where we have the mylohyoid? This one. From this specimen is here. Mylohyoid. Or from the... so maybe I show you all the suprahyoid here. What's of course the potential to mark invisible. Mylohyoid. The next one you have probably the geniohyoid. Yes? So this one is the geniohyoid here. This one is a genioglossus, and this one is a this one is a glossohyoid. So, but this is the internal muscle of the tongue. So this one mylohyoid, geniohyoid, and here you see the fibers of the digastric muscle. Which belly? Anterior belly of the digastric muscle. And where is the posterior belly of digastric muscle? Yes, and probably I see here. Bless you. So this one is a posterior belly of digastric muscle, you see? Here. And this one is visible here. This is the posterior belly of digastric. Maybe, no, it's not easy. But here from this specimen, yes. Anterior I marked you. And the stylohyoid probably, yes?
Yeah.
But here you see the stylohyoid muscle? No, here is visible because this is a place where goes the stylohyoid muscle. But maybe I show you from the isolated. We have the, no. Maybe here I show you where maybe it's visible or not. What do you think here? You find the stylohyoid muscle here. No, I see only this. Here it's so deep, it's not visible. So where I have the isolated larynx, I show you the stylohyoid. And here once again we see the digastric anterior belly of the digastric muscles. This is the same but opposite side. Here you see the mylohyoid muscle, and from the suprahyoid is all what we see from this specimen. And the next one is the infrahyoid, yes or not? And of course the tendon, probably from your list. Intermediate tendon. So we have the two muscles who have the intermediate tendon. One is the digastric muscle. Yes, so here you see the intermediate tendon. Now we marked. So this is the region where insert to the hyoid bone. And the intermediate tendon has which muscle? This one, omohyoid. Yes, so here you have the intermediate tendon down. Yes, it's visible here. And this one, you see? Here, all of this part, yes. This is the intermediate tendon. And the infrahyoid muscles, so here you see the superior belly of omohyoid muscle and the inferior belly, yes, of the omohyoid muscle. Here we have which muscle? The sternohyoid. The first one, sternohyoid muscle. This one is the sternohyoid. Here you see the fibers of the sternothyroid muscle. And here is visible the thyrohyoid muscle. Yeah? And this one, which muscle is here? You have from your list? Maybe no. The cricothyroid. Yes, cricothyroid muscle. You have from your list?
Yeah, it is on the list.
Yes?
It's on the list.
It's important. Why? You know? Why is this muscle is important?
Because it's the one that abducts
No, this no. The posterior
Posterior.
aspect, yes. And this one, why it's important? Because this muscle has the different innervating like the rest muscle of the larynx. You remember? Only this muscle innervate the superior laryngeal nerve, the internal fibers.
External.
Yeah, and the external, of course, the branch. Yes, innervate this muscle. The rest muscle innervate which nerve? The laryngeal recurrent. Yes. So this is aspect of the written test. I think one may be the answer of the question. Which muscle from the laryngeal muscles has the difference in innervating? So this is the cricothyroid muscle. Okay, and
Sternocleidomastoid.
sternocleidomastoid. This one you see. So here you have the two bellies. This one is the medial belly or sternal belly. This one is the clavicular belly, sternocleido, and here you have the common part. From this muscle, so what I mark like this, the sternocleidomastoid muscle. You must remember this muscle is the place where we have which nerve? Nerve of the cervical plexus. Yes, so this one where I mark like this, what is this? Erb point. We do not have the erb point from the list, but we have the nerve from the cervical plexus from the list. Are you sure?